Most people have eye problems at just one occasion or another. Some are minor and can get away on their own, or are easy to treat reception. Others need a specialist's care. Whether your vision isn't what it wants to be, or never was that great, there are belongings you can do to urge your eye health back on target. See if any of those common problems sound familiar. And always ask a doctor if your symptoms are really bad or don't clear up within a couple of days. Eye strain. Anyone who reads for hours, works at a computer or drives long distances knows about this one. It happens once you overuse your eyes. They get tired and wish to rest, a bit like the other a part of your body. If your eyes feel strained, give them a while off. If they're still weary after a couple of days, ask your doctor to form sure it isn't another problem. Their surface is roofed in blood vessels that expand when they're irritated or infected. That provides your eyes the red look. Eye strain can roll in the hay, then can a late night, a scarcity of sleep, or allergies. If an injury is that the cause, catch on checked by your doctor. Red eyes might be a symbol of another condition, like conjunctivitis, pink eye, or sun damage from not wearing shades over the years. If over-the-counter eye drops and rest don't clear it up, see your doctor. Night blindness. Is it hard to ascertain in the dark, especially while driving? Is it tough to seek out your way around in dark places, like movie theaters? That seems like nyctalopia. It's a symbol, not a drag in its title. Nearsightedness, cataracts, keratoconus, and a scarcity of vitamin A all cause a kind of nyctalopia that doctors can fix. Some people are born with this problem, or it'd develop from a condition involving the retina, which usually can't be treated. If you've got it, you'll got to be extra careful in areas of low light. Lazy eye, or amblyopia, happens when one eye doesn't develop properly. Vision is weaker therein eye, and it tends to maneuver lazily around while the opposite eye stays put. It's found in infants, children, and adults, and infrequently affects both eyes. Treatment must be sought immediately for infants and youngsters. Lifelong vision problems are often avoided if a lazy eye is detected and treated during infancy. Treatment includes corrective glasses or contact lenses and employing a patch or other strategies to form a toddler use the lazy eye. Cross eyes, strabismus, and nystagmus. If your eyes aren't lined up with one another once you check out something, you'll have strabismus. You would possibly also hear it called crossed eyes or walleye. This problem won't get away on its own. You'll got to get an ophthalmologist, or eye specialist, to correct it. With nystagmus, the attention moves or jiggles all the time on its own. There are many treatments, including vision therapy to form your eyes stronger. Surgery is additionally an option. Your doctor will examine your eyes to ascertain which treatment might work best for you. Colorblindness. When you can't see certain colors, or can't tell the difference between them, usually reds and greens, you'll be colorblind. It happens when the color cells in your eye, the doctor will call them cone cells, are absent or don't work. When it's most severe, you'll only see in reminder gray, but this is often rare. Most of the people who have it are born with it, but you'll catch on later in life from certain drugs and diseases. Your doctor can tell you what's responsible. Men are far more likely to change state with it than women. Your ophthalmologist can diagnose it with an easy test. There's no treatment if you're born with it, but special contacts and glasses can help some people tell the difference between certain colors. Uveitis. This is the name for a gaggle of diseases that cause inflammation of the uvea. That's the center layer of the attention that contains most of the blood vessels. These diseases can destroy eye tissue, and even cause eye loss. People of all ages can have it. Symptoms may get away quickly or last for an extended time. People with system conditions like AIDS, atrophic arthritis, or colitis could also be more likely to possess uveitis. Symptoms may include blurred vision, eye pain, eye redness, light sensitivity. See your doctor if you've got these symptoms and that they don't get away within a couple of days. There are different sorts of treatment for uveitis, counting on the sort you've got. Presbyopia. This happens once you lose the power, despite long-way vision, to obviously see close objects and little print. After age 40 approximately, you'll need to hold a book or other reading far away from your eyes to form it easier to read. Kind of like your arms is just too short. Reading glasses, contact lenses, LASIK, which is laser eye surgery, and other procedures are often want to restore good reading vision. Floaters. These are tiny spots or specks that float across your field of vision. Most of the people notice them in well-lit rooms or outdoors on a bright day. Floaters are usually normal, but they often are a symbol of a more serious eye problem, like detachment of the retina. That's when the retina at the rear of your eye separates from the layer underneath. When this happens, you would possibly also see light flashes alongside the floaters or a dark shadow encounter the sting of your sight. If you notice a sudden change within the type or number of spots or flashes you see or a replacement dark curtain in your sight, attend your ophthalmologist as soon as possible. Dry eyes. This happens when your eyes can't make enough good quality tears. You would possibly desire something is in your eye or like it's burning. Rarely, in severe cases, extreme dryness can cause some loss of vision. Some treatments include using a humidifier in your home, special eye drops that employment like real tears, plugs in your tear ducts to reduce drainage, lipoflow, a procedure that uses heat and pressure to treat dry eyes, testosterone eyelid cream, nutritional supplements with animal oil and omega-3. If your dry eye problem is chronic, you'll have dry disease. Your doctor could prescribe medicated drops like cyclosporin, Sequa, Restasis, or Lifeigrast, Shidra to stimulate tear production. Excess tearing. It has nothing to try to do together with your feelings. You would possibly be sensitive to light, wind, or temperature changes. Attempt to protect your eyes by shielding them or wearing sunglasses. Go for wraparound frames, they block more wind than other types. Tearing can also signal a more significant issue, like an eye fixed infection or a blocked lacrimal duct. Your ophthalmologist can treat or correct both of those conditions. Cataracts. These are cloudy areas that develop within the eye lens. A healthy lens is obvious sort of a camera's. Light passes through it to your retina, the rear of your eye where images are processed. Once you have a cataract, the sunshine can't get through as easily. The result, you cannot see also and should notice glare or a halo around lights in the dark. Cataracts often form slowly. They do not cause symptoms like pain, redness, or tearing within the eye. Some stay small and do not affect your sight. If they are doing progress and affect your vision, surgery nearly always works to bring it back. Glaucoma. Your eye is sort of a tire, some pressure inside it's normal and safe. But levels that are too high can damage your nervus opticus. Glaucoma is that the name for a gaggle of diseases that cause this condition. A common form is primary chronic glaucoma. Most of the people who have it don't have early symptoms or pain. So it is vital to stay up together with your regular eye exams. It doesn't happen often, but glaucoma are often caused by an injury to the attention, blocked blood vessels, inflammatory disorders of the attention. Treatment includes prescription eye drops or surgery. Retinal disorders. The retina may be a thin lining on the rear of your eye that's made from cells that collect images and pass them on to your brain. Retinal disorders block this transfer. There are different types. Age-related degeneration refers to a breakdown of a little portion of the retina called the macula. Diabetic retinopathy is damage to the blood vessels in your retina caused by diabetes. Retinal detachment happens when the retina separates from the layer underneath. It's important to urge an early diagnosis and have these conditions treated. Conjunctivitis, pink eye. In this condition, a tissue that lines the rear of your eyelids and covers your sclera gets inflamed. It can cause redness, itching, burning, tearing, discharge, or a sense that something is in your eye. People of all ages can catch on. Causes include infection, exposure to chemicals and irritants, or allergies. Wash your hands often to lower your chance of getting it. Corneal diseases. The cornea is that the clear, dome-shaped window at the front of your eye. It helps to specialize in the sunshine that comes in. Disease, infection, injury, and exposure to toxins can damage it. Signs include red eyes, watery eyes, pain, reduced vision, or a halo effect. The main treatment methods include a new eyeglasses or contacts, prescription medicated eye drops, surgery. Eyelid problems. Your eyelids do tons for you. They protect your eye, spread tears over its surface, and limit the quantity of sunshine which will get in. Pain, itching, tearing, and sensitivity to light are common symptoms of eyelid problems. You would possibly even have blinking spasms or inflamed outer edges near your eyelashes. Treatment could include proper cleaning, medication, or surgery. Vision changes as you grow old. You'll find that you simply can't see also as you once did. That's normal. You'll probably need glasses or contacts. You'll prefer to have surgery, LASIK, to correct your vision. If you have already got glasses, you'll need a stronger prescription. Other, more serious conditions also happen as you age. Eye diseases like degeneration, glaucoma, and cataracts can cause vision problems. Symptoms vary tons among these disorders, so continue together with your eye exams. Some vision changes are often dangerous and wish immediate medical aid. Anytime you've got a sudden loss of vision, or everything looks blurry, albeit it's temporary, see a doctor directly. Attend the ER or call 911. Problems with contact lenses: they work well for several people, but you would like to require care of them. Wash your hands before you touch them. Follow the care guidelines that came together with your prescription. And follow these rules. Never wet them by putting them in your mouth, which will make an infection more likely. Make sure your lenses fit properly, in order that they don't scratch your eyes. Use eye drops that say they're safe for contact lenses. Never use homemade saline solutions. Albeit some lenses are FDA approved for sleeping in them, doing so raises the danger of a significant infection. If you are doing everything right and still have problems together with your contacts, see your ophthalmologist. You would possibly have allergies, dry eyes, or simply be more happy with glasses. Once you recognize what the matter is, you'll decide what's best for you.
I hope you are enjoyed watching this video about health issues. Comments, likes and share. Subscribe to our channel and learn more about new things. If you have any problem related to health, then you will contact Health Issue page.